contracts the virus will have symptoms. The CDC estimates that 2.2 million Americans are chronically infected. CDC estimates annual deaths due to hepatitis B virus are around 14,000 people. Approximately 25% of those who become chronically infected during childhood and 15% of those who become chronically infected after childhood die prematurely from cirrhosis or liver cancer, and the majority remain asymptomatic until onset of cirrhosis or end-stage liver disease. The following populations are at increased risk of becoming infected with hepatitis B virus: infants born to infected mothers, sex partners of infected persons, men who have sex with men, injection drug users, household contacts or sexual partners of known persons with chronic hepatitis B virus infection, healthcare and public safety workers at risk for occupational exposure to blood or blood-contaminated body fluids, and hemodialysis patients. You make 1 part household bleach to 10 parts of water for disinfecting the area. All disinfectant should be allowed to dry the required amount of time for maximum effectiveness. Gloves should be worn when cleaning up any blood or blood spills. Clinics should have an exposure control plan. Universal precautions should be used at all times. PEP plan should be in place for all clinics. Use labels to communicate hazards and training provided to healthcare workers. The DCI post-exposure prophylaxis policy, more commonly referred to as PEP, was established in December 1998, specifically for the management of all significant employee occupational exposures of the needle stick or cut with soap and water. There is no scientific evidence that shows that the use of antiseptics or caustic agents such as bleach, or that squeezing the wound will reduce the risk of transmission of a bloodborne pathogen. Doing so only results in more insult to the site. In the event of a splash exposure, liberally flush exposed skin with water, irrigate or flush your eyes and or mucous membranes with clean water, saline, or sterile irrigants. Step 2. Immediately report the exposure to the charge nurse and or nurse manager. Do not wait. The faster it can be reported, the faster the interventions can take place. Step 3. Assess the risk exposure using the CDC exposure code algorithm, which can be found in your clinic's PEP manual or on the DCI intranet. This will assist you in determining